Hello, everyone, and welcome to another episode of ConCensis, a podcast from Censis Technologies. I'm your host, Tyler Kern. Thanks so much for joining an episode of the show about utilization assessments to uncover blind spots in your SPD. And so we're going to dive in and discuss all of this today with Cody Pregler, educator at Censis Technologies. Cody, welcome to the podcast. Thanks for joining me.
Thanks, Tyler. Thanks for having me. I'm really excited to be here and really looking forward to our podcast today.
I'm looking forward to it as well. I think this is going to be a great, engaging conversation and really educational and informative for our audience. And so, Cody, let's dive in here. How does a Service Plus assessment prepare customers for surveys and inspections? Give us a little bit of detail there on how that preparation can help in the long run.
What a utilization assessment report is, it's where we come on site and we look and see exactly how you're using CensiTrac. What this entails is us following a container around the life cycle in the hospital, in your facility. And when we do this, what we do is we uncover blind spots in certain areas where we can improve a little bit as far as making sure that we can really track our medical equipment or our medical instrumentation through their full life cycle process. So what that assessment does is that assessment provides all the blind spots in areas that you're maybe not doing such a good job of scanning or recording. And so with AAMI standards and Joint Commission, these different governs that govern over the sterile processing departments, they have expectations as to what we should be doing in those environments. And so a utilization assessment report can really show you some of those areas where you can really strengthen your process at your facility. That way we can, make sure that we're doing everything and hitting all the check marks and checkpoints that we're supposed to be as we're sending things through that life cycle process.
Excellent stuff, Cody. I think that's really well put, especially on the topic of compliance, which is obviously an important one, an important thing to discuss. If we move over to functionality now, when performing an assessment or training, how does Censis really stay ahead of the future as you continue to look out ahead and project forward? How does Censis enable that?
Well, luckily, Censis, what we've done is in the clinical team, we've hired a lot of people with sterile processing knowledge, people that have worked in the field for a long time. Myself, I've worked in the sterile processing field for about 17 years. And so our team has a lot of experience and knowledge to what we should be looking for when Censis comes and visits you on site. And so with that knowledge, what we do is we try to make sure that you're, doing exactly what we need to do if a surveyor, a Joint Commission surveyor, would come on site and look at your hospital. What that surveyor does is he comes and makes sure that, if a tray has a certain process that it needs to go through, that we're adhering to all of the standards and all of the steps to that particular process. And so what Censis can do is it has lots of tools and things that we can do to make sure that these things are happening. One of our easiest tools that we provide our customers is what's called out of sequence warning. And what this does is it tracks that tray and those instruments as they're moving through the process to make sure that it's hitting every checkpoint that it needs to. In those checkpoints, they reveal information about what processes or what's being performed on that instrumentation as it's traveling through its little life cycle. And so Censis stays ahead of the game by creating more tools. The environment's always ever changing, right? Things that we did in sterile processing 10 years ago are not the same that we do now. And it's really crazy, especially when we get to talking things like flexible endoscopes. What we've learned through science and technology is so much more advanced now than what we thought 10 to 15 years ago. And so CensiTrac has the tools and the capability to make sure that we can document those processes electronically. We want to document all this stuff electronically versus it being in a paper format somewhere. So that way, it really gives us data and analytic tools to process that data and make sure that things are happening the way they're supposed to be.
That's a great point. One of the things and one of the common things that Censis has heard around the country has been that there's a lack of staffing in SPD departments, and that is a big problem and a big issue that people are running up against. There's just simply not enough people in some cases and in a lot of cases across the country. How can Censis help with that process as well? And how can Service Plus really help with the current SPD status as it relates to staffing?
Absolutely. There's definitely a national shortage of SPD staff right now. With all the crazy stuff that's going on, it's just hard to keep good staff in those areas. There's even a shortage of what they're called travelers that come and work in these departments. And so what CensiTrac provides is hopefully to make those things easier and make it to where we're not double working. We're not doing things double, making sure that we're staying compliant. We can start seeing things efficient. Where are we losing time at? Where are we really struggling at? Okay. That way we can really alleviate some of those processes and make sure that they're more intact. Why are we doing this? Oh, I don't know why we were doing that. And now, let's get rid of that if it doesn't serve a purpose or have, some importance to the process. Then now we're alleviating, more time for the staff to really be efficient. There's certain things which are called tasks that you can go and look and see how long it's taking the task for the staff to complete them. And in those tasks, it reveals a lot of information where you might need more help. Things where there's bottlenecks in your department where, things are really slowing down at this one point. So we need more help there, right? And then that way we can really speed that process along. What it also does is, will help you provide some type of quality checking for those processes. We want to be able to make sure that we're doing them right, because if we're not doing them right, then again, we're going to have to do them over, or we're creating more problems and more work for us down the line. One of the things is I've been doing this, I've saw a lot of different hospitals that I've been to. And as I've gotten to some of these different hospitals, one of the cool tools that CensiTrac has is what's called case tracking. And so this facility wasn't using the case tracking module. So the Service Plus team came out, said, hey, this is something that we think you could really utilize and really, really better your facility by using this. And we went and trained on it that week. And as we trained on it, we were tracking the flexible endoscopes back to the patients. And so that way, if there was any issues, we could go and look at those scopes, make sure that the process that it needs to go through, that high-level disinfection process, is being completed. All the testing and things that are needing to be done during that process were being completed. And there was actually an issue that arose when I was there at the facility. And we were able to go back and track all that information and really make sure that the process was completed properly in that sterile processing. And so it's really cool as just the tools as far as compliance and efficiency and just the ease of use for the staff. It makes things a lot easier when you can do it electronically versus having to read people's handwriting and chase things around in a paper format. It's not as easier in that environment as we'd like it to be.
Yeah, that's a great point. Having that technology that exists to provide visibility throughout the life cycle of these products, I think is absolutely key and really huge, and can provide those efficiencies necessary when staffing exists like they do right now. So I think that's a really great point, Cody. And so, I wanted to go back to something that you talked about earlier, and that was process gaps. Facilities aren't documenting necessarily that sets are clean. How does identify those process gaps, like you mentioned? Give us some details and maybe flesh that out in a little bit more detail for us.
Yeah, well, process gaps can be kind of multiple things, right? It could be just not tracing or tracking something to those different decontamination areas or the assembly areas on where they're being, where they're at in that process, right? Because we need to clean the instruments, wash the instruments, and then we need to put them back together and make sure that all the instruments themselves are clean and functioning properly for use in the surgery environment. And so what CensiTrac can do is help spot those or point out those process gaps. I know I mentioned earlier a little bit the out of sequence warning. When that happens and we're missing those things, CensiTrac takes note to them, and then we can go back and run a report later and say, okay, where were we missing certain things? And it gives us a report and nice visible evidence. Hey, look, this is what we're missing. What it also has the capability to do is, process gaps can happen in your sterilization documentation. That's one of the biggest things that we run into when we're on site with customers. There's always gaps in the documentation. Well, this is a big problem because it's kind of a common saying in CensiTrac, or not in CensiTrac, but in the sterile processing environment that if you didn't document it, it didn't happen. We have to document, and that's the only way we can show proof that these things are truly happening. I always joke, there's no Scouts honor anymore, right? We really need to be able to see that process happen and document it. Well, and again, CensiTrac will provide some type of reports that we can see that the documentation is incomplete. It gives you the ability to go back in there, view that documentation, figure out who documented it. That way we can get them coached up and get them educated to make sure they know, hey, you're supposed to check all of these boxes as you were going through that documentation process. Those are some of the big hitters for the Joint Commission. The national surveyors, those people that come to the healthcare industry. That's one of the big places that they go and look is documentation. Because again, if you didn't document it, it didn't happen, and then there can be a lot of issues that can arise from those things. So CensiTrac does a really good job of bringing those things to light. We're not Joint Commission. We're not here to beat on you and pick on you or anything like that. We're here to help you understand, hey, these are areas of improvement that we think we can do. And with those, you get options from the Service Plus team. What you get is, do you want more training? Is that something that we want to come out, or is there some other areas that we also offer? We got marking services, we got data services. What type of things can we do to help you to make this process successful? Because if you don't give them the tools to succeed, then what are you asking of them?
Yeah, that's a great point. That's a great point. And I love that idea that if it's not documented, then you can't count on the fact that it's happened. And so that's a great point, and I think a great reminder for everyone. Absolutely. So, we've talked a couple of different times about Service Plus here in this podcast, but there might be people out there listening or watching this podcast that don't know a ton about Service Plus, and so don't really know the ins and outs and the details. So, can you tell us a little bit more about Service Plus and the benefits and what's included in that subscription?
Absolutely. So the Service Plus is a program provided by the clinical team. The clinical team works closely with client services to make sure that we can make our customers better CensiTrac users, more AMI compliant, all the big hitters to make sure that we're doing the steps that we need to do in that sterile processing environment. And so what that Service Plus is we come out, the clinical education team. Usually just one individual comes and does an assessment or a utilization assessment in your facility. This is where we follow trays around. We look at what, features that you're using or not using in CensiTrac. That way we can say, hey, these benefits or these tools that would really help your sterile processing. Once we've completed that utilization assessment, we get together and we have a call and we say, hey, here's the things that we found, and here's some training issues or some, not training issues, but here's some training options that you have. Okay. Is it something that you would want us to do is come out for a week of training? It's where you get a clinical educator. They come out, they help educate your group. They run in services with your staff or your leadership to make sure that everybody knows, what their role is as far as CensiTrac. Once they're done that week, you always have access to that clinical team too. I like to say whenever I go on site, the customer's a part of my team, and I truly mean that. And so, I get phone calls all the time. Hey, how do I do this? Or, point me in the right direction. So we always make ourselves available to that team. If you don't decide to go with the training route, there's a marking route. So this is really something more for the CensiTrac advanced users. With the instrument mark, what they can do is they can come out and mark your instrumentation for you. I think it's a week of marking. Once that week of marking is done, those things get commissioned into CensiTrac to really help that instrument tracking level of CensiTrac use. And the last option was a data services option. A lot of times in sterile processing, they get new management or new folks in the department, and so somebody kind of takes the reins over and doesn't mean that all the information being entered into CensiTrac comes in as clear or as premier as maybe we would want to when we're entering data. And so what the clinical team data services option is we can clean some of those things up by adding or adding weights and certain things to that information to make it more complete for better feature use in CensiTrac. One other thing that the Service Plus option gives you is free registration to the CTUC, which CTUC is our users conference. This is a really great place that we get people together, whether it's virtually or in person, and we talk about how other customers are using CensiTrac. This is really good and valuable to the customers. A lot of people use CensiTrac different ways, with sterile processing environments being so different. Everyone's so different that they need to be very adaptive to how they use CensiTrac. And so this is a great way for people to get together. And when they get together, they get to talk about CensiTrac, how they're using it in their facility, see better ways to use CensiTrac and be more efficient using it as a user. So those are great things about that Service Plus side as well. You also get a registration to what's called CEM course. It's our CensiTrac Essentials for Managers. A lot of facilities tend to get new management, and so it's nice to give them a little chance to brush up on CensiTrac and make sure that they know all the tools that they have at their disposal. So that CensiTrac CensiTrac Essentials for Management is a really good way to get them up to speed if they come new to your facility. So these are just two nice little bonus options that you get when you're using that Service Plus group or that Service Plus program.
Excellent stuff, Cody. So again, to wrap up our conversation here today, we've covered a lot of ground, specifically kind of identifying and covering those blind spots that can exist within SPD operations. And so, Cody, as we wrap up our conversation today, any final thoughts, anything you want to leave our listeners and viewers with on the importance of these things and what CensiTrac can provide?
Yeah, the big final note for me would be, is if you're a CensiTrac user, you have all these tools, right? Use them. Make your department a high-functioning sterile processing department. You're providing better healthcare to your community. It's just such a place that doesn't get as much knowledge and recognition, and I think that CensiTrac is one of the big leaders in trying to bring those things to light. We want clean, nice sterile processing that's processing good instrumentation for use on patients. We want the most premier healthcare we can get, and it really starts in the sterile processing department.
Fantastic stuff. Cody Pregler, clinical educator at Censis Technologies. Cody, thank you so much for joining us here on this episode of ConCensis and sharing a little bit more about these topics and educating us.
Hey, well, thank you for having me, Tyler. Have a great day, and we look forward to talking again.
Absolutely. And everyone out there, thank you for joining us for another episode of the show. For more, make sure to reach out to Censis Technologies if you have questions, if you want to learn more about Service Plus. Make sure to visit their website and to subscribe to stay up to date with the latest information from Censis Technologies. And stay tuned. We'll be back soon with new episodes of the show. But for this one, from my guest today, Cody Pregler, I've been your host, Tyler Kern. Thanks for joining us.